Assalamu alaikum wa rahmatullahi wa barakatuh. Today our video about stress. We can define stress as a feeling of emotional or physical tension, and it can come from any event. We must understand that stress means not fatigue. Stress means response to stressor, and this response may be chemical or biological agents, sometimes environmental condition, otherwise external stimulus, or psychological. In these stressors, the individual may consider the challenging. He will become ready to respond, either fight or flight. And we have what we call it the general adaptation syndrome. This is the response, general adaptation syndrome, and this response, either physical activity, as I say, fight or flight, or emotional, it appear on your face. If you are miserable, if you are happy, if you are, this is, we call it emotional. And this general adaptation syndrome have three phases. The first one is alarm phase, this to respond to the stressor, and the second one is resistance. This is advanced stage of alarm, and the third one is exhaustion. That is the final stage, and in this stage must be found a treatment or solution for the situation that caused by the stressor. Now, what are the events that occur during alarm phase? The first stage of response to the stressor, the first stage of stress. First, to fight or flight, we must have energy, and the source of energy is glycogen. So the first one, glycogen degrades to give us glucose, and this glucose is the main source of ATP, and this ATP the cell uses it for its function for response. And this is the glycogen from liver. The adrenal gland secrete these hormone, adrenaline and noradrenaline, as well as cortisol. Each one has special function to respond. Adrenaline and noradrenaline lead to production of ATP from glucose, as well as it increase the mental alertness, as well as the cell use this energy, and there will be change in circulation. These hormones may be delay or fastening the circulation, and also there will be increase in sweat gland activity, as well as we have increase in respiratory and heart rate. All these response is due to adrenaline and noradrenaline action. A cortisol, this hormone, decrease immune response. This is very important, because the second phase is the resistant phase. What will happen in resistant phase? First, for advanced response, we need more epinephrine, and we need growth hormone, and all these induce metabolic process, and to supply the body with energy for response to the stressors. And in this phase, we found that the glycogen will be depleted because of excess using of glycogen for production of glucose. So the other source for glucose will be lipid, amino acid of muscle, and these lead to loss of weight. because when we use the lipid and the protein to produce energy, so there will be loss of weight and muscle mass. And also we found elevation of blood glucose because there will be increase in metabolic process to produce glucose from glycogen and other source of glucose. Also in this phase, the pancreas secrete glucagon. You know that pancreas secrete two hormones. One of them is insulin. This is decrease level of blood glucose, and the glucagon, which increase the level of glucose by increased glycogenolysis. This is mean breakdown of glycogen in the liver or in the other. And the fourth is secretion of aldosterone. I hope you remember it when we speak about the fluid and homeostasis. Aldosterone lead to reabsorbed natrium, the sodium, and this is lead to reabsorb water. This is to not allowed to lose water. So aldosterone lead to reabsorb natrium from the renal tubule and increase H2. As well as if there is reabsorption in natrium, there will be secretion in calcium, the potassium, and this is very important for the final phase of general adaptation syndrome. This we call it the exhaustion. So the person will be exhausted. He cannot resist. He cannot resist the stressor. So it may be lead to death if there is no medical intervention. Why? As I said before, aldosterone conserve sodium or natrium, reabsorb sodium, and the same time loss of secretion of potassium. And we must know that potassium or calcium is very important for the heart work, and it may be to lead to stop the heart work. Now you see in this we summarized the function of hormones during stress. When we have stressors, we have, as I say, physical or environmental stressor. If it is physical or environmental or biological, as we listed before, there will be secretion of norepinephrine, epinephrine from the adrenal gland and from the sympathetic nerve end. So we have two sources for norepinephrine and one source for epinephrine. These hormones lead to vasoconstriction, and this is lead to skin become pale, become yellow, and this is in especially in fair when there is creating stressors, and also increase blood pressure as well as increase the heart rate. And this is very important for the first phase and the second phase of general adaptation syndrome. Epinephrine also lead to vasoconstriction, and we know that if we have vasoconstriction, the pressure will be increased. And we have bronchodilation. That means we to inspire much air, and you see here we have reverse relation between the vasoconstriction and bronchodilation. If we have vasoconstriction, we have a bronchodilator. If we have vasodilator, we have bronchoconstriction, and this is lead to increase oxygen, as I say, increase inspiration of air. Now in this side, what hormone we have? We have cortisol and aldosterone, and we explained it before. the aldosterone lead to reabsorb natrium and water and increase blood pressure, and cortisone lead to increase blood pressure, increase the volume, and delay healing if we have injury, and this many stress lead to gastric ulcer. Gastric ulcer. Now, what we have more here from the pituitary gland, the posterior loop of the pituitary gland, secretion of antidiuretic hormone or the vasopressin. What is the action of antidiuretic hormone? It increases blood volume by increased blood pressure, as well as it increases the permeability of renal tubule to reabsorb water. And when we have reabsorption of water, we have increase in the blood volume, so we have increase in blood pressure. This is all for the general adaptation syndrome, and thank you.